characteristic by a few different behaviors. These can include social interaction skills, communication difficulties, and repeative tendencies. People with autism spectrum disorder can have different symptoms that range in intensity. These can be measured in intelligence, social interaction, communication, behaviors, sensory, and motor. For example, some people who may have limited language while others do not.
Children with autism are usually diagnosed before the age of 3 and can be diagnosed as early as 18 months. Some early symptoms include delayed language development, like not responding to their name by 12 months, lack of interest in games and play, emotional outbursts, difficulty understanding feelings and facial expressions, lack of eye contact, and unusual reactions. As children get a little older, there are other behaviors they may display. This can include social isolation, flapping of their hands, and rocking of their body, or may avoid or resist physical contact.
There is currently no known exact cause of autism spectrum disorder. However, it is associated with abnormalities in brain structure and function and characterized by abnormal brain growth in the first 2 years. One possible cause is genetics, which a child can inherit from their parents. Autism spectrum disorder is known to run in families, and twins are more likely to both develop autism. Some medical conditions that are associated are Fragile X syndrome, Williams syndrome, and Angelman syndrome. Another possible explanation is the environment. Prenatal infants who are exposed to alcohol, medication, or certain drugs are at a higher risk of development of autism spectrum disorder. Premature birth may also be associated with this disorder.
Autism can be treated and managed in many ways. Early intervention is the best and usually includes intensive behavior analysis and skill building. Social interaction, communication, and cognitive skills are usually targeted. The intervention works by breaking down the skills into simpler tasks that can be achieved by the person and eventually developed into more complex abilities. Other options to treat certain behaviors include speech, physical therapy, and occupational therapy. There's no medicine to treat autism spectrum disorder, but some medicine can treat related disorders such as hyperactivity, depression, anxiety, and OCD.
I was diagnosed with autism when I was around 3 years old, and by the time I get a therapist and some tutors growing up. Some characteristics that it affects my brain development and how it lets me see the world differently than most other people. I was probably reading because sometimes I have difficulty with reading and probably understand some words. I overcome some math stuff, like I struggle with math a little bit, I get good at my math classes in high school, and like algebra and stuff. One of my biggest achievements ever that I got into the CCS program, TCNJ. I did a program because there's some events and stuff. I get to live in a house and all sorts of stuff.